We continue to dig for answers tonight, and we have new information now about Indiana's plan to try and increase communication between long-term care facilities. This as the state still refuses to release the names of specific facilities seeing cases, even as others in the country do publish that same information. Good evening. Thanks for joining us today live at 5. I'm Dan Spieler.
And I'm Fianchin Stinger. Thank you so much for being with us. The governor responding to some of those questions today. Fox 59's Kelly Rinke has been following this issue from the beginning. She has our top story right now.
More than 1,500 COVID-19 cases are inside Indiana's long-term care facilities, but Indiana is not naming the sites with the virus.
It's very frustrating. You want to know that so you can make educated decisions on what to do with your family member.
Judy Spear is the power of attorney for her 96-year-old dad, Sam. He's been staying at the assisted living portion of Rosegate in Indianapolis. This week, he tested positive for COVID-19 and was moved to a hospital.
He's very tired. He's not eating well, having some irregular heartbeat.
She claimed she had asked the facility about the total number of COVID-19 cases there.
The corporate office had advised them to not give that information out. She did, after a discussion, she did say she would check with them and she will call me back later today.
Spear tells me someone did call her back and told her the number of cases. She was very grateful for that info. Today, Governor Holcomb said he will not direct the state health commissioner to release the names of facilities with cases, even though on Tuesday, Indiana's state advocate for residents of long-term care facilities told us that information should be revealed.
And the reason is because we respect that private business, that nursing home that is operating under our regulations, and that's where the relationship exists.
Right now, state officials and the advocate for residents are working on a plan to improve communication.
In addition to the residents that are in that facility, that for those people who would be coming to a facility as a new admission or as a transfer, that they also need to know the status of the facility in regards to COVID.
Here are some details on that plan. The state will instruct facilities to reach out to residents and families to provide updates on how it's handling issues with care and staff shortages, general info about COVID-19, number of residents who have tested positive, and number who have passed away due to the virus. Woody Myers is the former state health commissioner. He's also running for governor. He believes the names of facilities with COVID-19 should be released.
I think that's essential information. Other places are doing it. I don't see any real legal restriction on making that information available. I'm not a lawyer, but if other places are doing it, I hope we can then quickly do that here.
We expect to learn more about the state's plan on Monday. In Indianapolis, I'm Kelly Rinke, Fox 59 News.
Well, American Senior Communities operates 34 facilities in central Indiana, including Rosegate. We asked them to share the number of COVID-19 patient cases at some of their facilities after families told us they're having trouble getting that information. Well, in a statement, ASC tells us this, quote, "Transparency and communication with families is important to us. Should a positive COVID-19 case occur, all residents, families, and employees are notified." Now, the company did not share coronavirus numbers with Fox 59.